You're responding to a 26-year-old male who's been shot.
Okay. BSI seen safe.
Scene is safe.
Okay. Is this my only patient?
You have one patient.
Okay. I'm gonna ask for ALS backup. So I'm walking to the patient. Do I see any blood?
Yes, you have blood all over the front of the patient, their chest, and their legs.
Okay. I'm gonna have one EMT hold the C-spine, another EMT cut everything off. Looking at the chest, do I see?
You have a hole in his upper right chest.
Okay, I'm gonna put a gloved hand on that. Do I see anything on the legs?
You have some bleeding on his upper left thigh.
Okay, I'm gonna have another EMT put pressure and a tourniquet on that. And somebody needs to get me an occlusive dressing. I'll put an occlusive dressing on that. Is the bleeding stopped on the thigh?
It is.
Okay, so while the EMT is holding C-spine, we're gonna flip the patient log roller. Do I see anything on the back here?
You have a hole, or what appears to be an exit wound on the right side of his back.
Okay, I'm gonna put a gloved hand on that and then apply another occlusive dressing rapidly. We'll put the patient back down. Is the patient breathing?
He is.
Okay. Is the airway clear and patent?
He has snoring respirations.
Snoring
Some blood in his
respirations.
airway.
So we're gonna try to put in an OPA. Does he accept that?
He does, but he still has blood in his airway.
Okay. Oh, okay. Well, then we're gonna suction the airway before we put the OPA in.
Airway's clear?
Airway's clear. Does he accept the OPA?
Yes.
Okay. We're gonna put a C-collar on him. My general impression is that this is a 26-year-old male that's been shot in the chest and in the thigh. Do I find any other wounds on the back of the thigh, or is it just that one?
You just have the one wound on the back of the thigh.
Okay, so this is going to be a rapid trauma transport. We're going to get him into the back of the ambulance and do a rapid secondary assessment in the ambulance. We're also going to put a warm blanket on him, and so what is the respiratory rate?
Respiratory rate is about 36.
36. And is it shallow?
It is very shallow.
So we're going to have somebody start bagging him with the BVM and high concentration oxygen, 15 liters a minute. And that should be done before we get into the ambulance. Now we're in the back of the ambulance on our way, lights and sirens. I'm going to perform the rapid secondary assessment. So on the head, are there any holes, any depressions inside the ears, CSF, mouth, for any teeth, nose for any CSF, eyes, check the pupils, are they equal?
They are equal.
Okay, so the neck, I'm looking for tracheal deviation and JVD. Any crepitus?
No crepitus, no tracheal deviation, no JVD.
Okay, the chest, I'm looking for any flail segments. I'm listening to the lung sounds. Do I hear?
Absent on the right, diminished on the left.
Okay. So while the EMT is bagging the patient, we're going to try to burp the occlusive dressing. Does that help at all?
It does help.
Okay.
Somewhat. Respirations become a little bit deeper.
Okay. So then we're going down to the abdomen. Any swelling or tenderness?
Nothing.
Nothing. Okay. Pelvis?
Stable.
Stable. Okay. Feeling on the thigh, is that bleeding still stopped?
It is.
Okay. And then any crepitus, decap, ETLS, pedal pulse is gone on this side?
It is gone on that
Okay.
side.
And then on the left side of the patient, any decap, ETLS? Pulse?
You do have a pulse on that side, no
Okay.
trauma.
Upper extremities, any DCAT, BTLS?
No,
Okay, and then pulses?
you do have pulses bilaterally.
Okay, so calling in medical direction, we have a 26-year-old male. He's been shot in the chest and in the thigh. We've applied occlusive dressings. His respiratory rate is 10 to 12 per minute. And actually, before I call medical direction, I should probably have the vital signs. So I'm gonna check the vital signs real quick. What's his blood pressure?
Blood pressure is 90/60.
Okay. Pulse?
Pulse is 140.
Okay. SpO2?
SpO2 is 92%.
Okay. Is the patient still unresponsive?
It's still unresponsive.
Okay. So I would get a sample history, but I cannot do that. So going into medical direction, 26-year-old male, has been shot in the chest and in the thigh. Bleeding's been stopped. Blood pressure is 90/60, pulse is 140, SpO2 92%, and we're bagging him at 10 to 12 a minute on 15 liters. We'll be there in 5 minutes. So
We'll see you then.
reassessing the vital signs every 5 minutes. I would check for a tracheal deviation and JVD to see if that's developing again. And I would check the breath sounds along with the vital signs. Or is there any improvement or deterioration?
Breath sounds are a little bit better after burping the dressing.
Okay. And with that, we arrive at the hospital, and I'll give my report. I have a 26-year-old male who's been shot in the chest and in the thigh. We applied occlusive dressing to the entry and exit wound on the chest, and then a tourniquet to the thigh. The bleeding's been stopped. Baseline vitals was blood pressure 90/60, pulse 140, SpO2 92%, and we are breathing for him with the BVM. Yeah, I don't think there's, yeah. I don't think there's anything else. If I didn't mention it, one thing that I would have done would be to apply a C-collar and secure him to a long spine board before moving him into the ambulance. And we did place a blanket on him to treat for shock. I did forget to assess for skin. Initially, was his skin pale?
Yes.
Okay. Was there any improvement in the skin in the back of the ambulance?
No.
No. And yeah, that's everything.